Yeah, still watching Morning Rush on Metro Television. We are live on DSTV channel 277, live on Facebook and YouTube is Metro TV Ghana. Don't forget to follow us on Instagram, Metro TV_GH. This morning we are talking about urine retention, but then before we talk to Dr. Prince Osei, who is the PRO for Medi, who has been with us for like 3 months now, giving us all the advice that we need. We'll look at a simple documentary from Medi, and when we come back, we'll talk about urine retention. Yeah.
There is a well-understood correlation that as the economy of a country improves, so the health of its people. Improving the health care of a nation's citizens can directly result in economic growth because there will be more people able to conduct effective activities in the workforce. Prostate problems in men, for instance, have been one of the greatest menaces we face as a people worldwide. Prostate enlargement, however, is a common illness which affects mainly men due to their biological composition or makeup. Research shows that prostate enlargement in itself is normal as a man ages, but becomes dangerous when it gets to the stage of cancer. One medical feat chalked up by a Ghanaian medical officer and plant medicine specialist, Dr. Digol Moses Dogbache, which has overwhelmed medical practitioners and manufacturers of orthodox medicine in the Western world, is the cure for benign prostate hyperplasia, BPH, or an enlarged prostate gland. This medical breakthrough, recorded by the Medimosis Prostate Center at Adenta Old Barrier in Accra, has earned Dr. Dogbache, the proprietor of the health facility, international recognition for his outstanding contribution to the healthcare sector. He has accordingly been honored with several international awards, including the International Arch of Europe Quality Award, IAE, during the majestic ceremony held in Frankfurt, Germany in 2013.
Medimosis Prostate Center from Ghana is receiving the International Arch of Europe Award here in Frankfurt 2013.
Dr. Dogbache came up with a specially formulated 100% food supplement called Prostacure Herbal Tea, used for improving urinary flow in men with BPH.
Before Medimosis Prostate Center came onto the scene, prostate issues were problems that were affecting men across the globe, and there was no definite solution to the problem except surgery. That's surgical operation, where we do either you do what we call TURP, transurethral resection of the prostate, that you take part of the prostate, or you do a total radical prostatectomy, which means that you take out the prostate with all its surrounding lymph nodes and things like that. And such operation comes with a lot of complications, and people wanted a reasonable alternative. And God being so good, we provided that reasonable alternative for the world. We introduced specially formulated product called Prostacure Herbal Tea. This is a specially formulated product, 100% natural, 100% herbal. And Prostacure Natural Tea is able to shrink the prostate gland no matter how big or large it is.
The prospective study, carried out in 7,000 patients between 40 and 70 years with varying degrees of enlarged prostate gland over a period of 4 years, showed complete improvement in their BPH symptoms within 2 to 8 weeks. Medically, what really is prostate enlargement and its related disorders?
Prostate is an organ in the male reproductive system which main function is to produce semen during sexual intercourse, and also it helps with erection in the male for men to be able to have sex.
Men, as we grow, we age, our prostate gland enlarges from the age of about 35 years or so, and it's just a part of complicated.
Prostate problems, enlargement, is something it's not a death sentence. It is something that can be taken care of if you take care of it in its early stages, and you can avoid having surgery. So when you go to your doctor and you get your regular checkup,
women also grow and they get their menopause. And men also grow, and we get our papapos. Our papapos is the prostate enlargement that people suffer from. And most men will go through that enlargement.
The major one that we mostly talk about is the prostate cancer. But apart from that, there are other conditions too that can affect the prostate. We have the benign prostatic hyperplasia, which is basically the prostate enlargement that we know of. And research has made us know that that is the #1 cause of prostate disorders in men.
My name is Reverend Osei, one of the 1965 Africa Cup winners. Growing, we know automatically as men and footballers, as people know us, we know we will get it. Unfortunately, most of us, including me, had a prostate before Medi took over to take care of us free of charge until to our death, which this thing could have been done by the government, which though because of Medi nothing of that sort has happened. Even recently, I noticed that there was something wrong. And when I went back to check, he was asking why I have been delaying. He was expecting us every month to just report, which is ever prepared to just cater for us.
I saw me John Botte now, Rubber Man, the intra Olympics, now Cheniketi, Black Star. No, now, then, now me share war he. War a hospital, or banyo budget, how insurance, okay, or a hospital, cash be no bagbo. Lele be me pite, the nake hila come here, here hila nidi prostate can be come. Lele a quo fair, a hair every time no small, ya jemmy. Nteje mpo afi na nteje afi nyodie na nteje ekwami ehami chufa nye me pi ajeme oke shida wo haleju gba ke ekwe wo noko ne sani ma afi ahawo ma afi ahawo ani afi ahawo onye me ko ko ame hechi ya me ko ame nya me nye jugba atu ama me ko ejom yegboi na anya afia hawo no na ekwe wo pepepe e hawo chufa shika this ade hewo
Medi Pare, former Black Star player, 1963-65. Esan say yare ya dia ya na se wo yare na se wo ni sika wo ho be kire pa ewu kra beti aba enti ofa saa ye no ma ye no na je se eye adekase pa na oye ma ye enti ye ka sisi ya po se ye de na se na onkoso.
Good and affordable healthcare makes an important contribution to economic progress as healthy population live longer and are more productive and save more. Many factors influence health status and a country's ability to provide quality health services for its people. Health presents a challenge for all nations. Effective public health care systems are essential for providing care for the sick and for instituting measures that promote wellness and prevent diseases. The success story of the clinic cannot be overemphasized.
Okay, so that's a very short documentary from Medi Moses Clinic, and we have Dr. Prince Osei here. We'll be talking about urine retention, but then, Doc, let's talk a bit about the video. How long has it been, the purpose of it, and you have something coming up later on in 2023.
Yes, so Medi Moses has been in existence, giving quality healthcare for 30 years this year. So, and we'll be crowning it in September this year. But viewers should look out for the team, the screening team. We'll be moving around the country where we don't have our offices, the northern part, the Volta regions and other part. We'll be coming there for free medical screening. That has been one of the things that Medi Moses have done for all these years. We go out there, screen people and get data, especially for the prostate condition. So people should look out for that.
Okay. That's good to know. I mean, over the years, what would you say are the values and principles that Moses has used as a way to stay on till this time, 30 years in the industry?
Yes, quality healthcare is one. Always making sure that you produce the right medications, especially because if someone comes and doesn't get the treatment that he wants, it means that it wouldn't go down well for the company. So we've always been producing quality medication, giving quality healthcare, and the free screening also has really helped because most men didn't know about the prostate. Most men didn't know that the prostate could be the #1 cause of many deaths in men. But when Medi Moses came and started giving this advocacy and all that, people has got to know that yes, there is something called the prostate and they need to take care of it.
Okay, that's great. So congratulations to Medi Moses, of course. Later this year, they'll be getting on to some things. We are going to talk about urine retention now. So if you've got any questions for Dr. Prince Osei, you can send that in on our WhatsApp number 0553 000035. Urine retention. Doc, welcome once again.
Thank you.
As we zoom into the conversation, Papa.
After the conversation, we'll talk about something.
I wanted to ask him before. So you
okay, you start. You ask.
No, I wanted to ask, how was your 14th February? How was your Valentine's Day?
When was 14th February?
2 days ago.
Oh, really? Was there something going on?
Valentine's Day.
Okay. I was on duty that day, I didn't really.
You didn't go to any of the concerts or any of the previous.
No, I couldn't. But I saw some.
But you gave out.
But you delivered
chocolates.
You distributed chocolates.
Yes, chocolate to my colleagues.
That's okay.
Eat chocolate.
And I saw some people's status. A lot of things were going on.
I want your status also.
People give message.
Anyway,
you see,
like someone snapping his fingers.
So let's talk about urine retention.
What exactly?
What is a urine retention?
Okay, so urine retention basically means the inability to pass urine. We always feel like urinating is a normal thing that anyone
should happen.
But it doesn't happen that way for some people. And within this week, we've had a lot of cases coming into Medi Moses with either acute retention or chronic retention. So as I'm talking about the types, I think I need to zoom in. And with the acute retention, what it means is that you are there all of a sudden and the urine is not coming. You were able to urinate previously, but you feel pressed now, you go to the washroom and the urine isn't coming at all. That is the acute retention. And it's a medical emergency. You need to be rushed to the hospital so that you can be intervened. Other than that, it can lead to so many things. I think last week we talked about cystitis and all that. And we learned that the urinary tracts are linked together. So the urethra, the bladder, the ureters, and the kidneys, they are all linked together. So when you have a retention and the urine is not able to flow, the likelihood of it going back to the kidneys to cause kidney failure and all that is very high. So that is one thing that we need to know. And people too may have chronic retention. With that, you are able to pass the urine, but some will be left in. So you wouldn't be able to completely empty the bladder. So at times it builds up and it can also cause the kidney failure and all that. So basically urine retention is the inability to pass urine either completely or partially.
You mentioned this week people are really coming in. Let's talk about the age groups. Which which age range is really coming in?
For urine retention, it happens to everyone, but mostly the aged, and especially male.
Okay.
Yeah, because of the presence of the prostate in men, they mostly get this retention. But women too can get when they have a condition that is called cystocele. Okay. Cystocele basically means that the bladder is drooping into the vagina. So there are some women that the bladder it's not strong, it's not able to hold the urine well, but it's sagging onto the vagina. And when it happens that way, it means that it can block the urethra and the urine wouldn't be able to flow. It mostly happens after childbirth. You know, when you are pregnant, the uterus sometimes presses on the bladder, and sometimes the pelvic floor can become weak, and it can lead to that cystocele. Also, infections can cause that. Last week we talked about cystitis, as I mentioned. That one, if you have the cystitis for quite a long time, it can cause the bladder neck to be unable to hold the urine. There is something there called the sphincter. That is what helps you hold the urine. But when you have chronic cystitis or there is an infection there that has been there for a very long time, it means that the sphincter there wouldn't be able to function well. That is what opens up for the urine to come.
Okay.
But when you have an infection, it means that it may not be able to open and you wouldn't be able to pass urine. So you could have an infection also there. So anyone at all can have this urine retention. Male, female, children can all have it, but it's more predominant in male. Even male. Constipation can cause urine retention. Yes, because because of the location of the rectum. When feces are packed there, it means that it can press on the urethra and you wouldn't be able to pass urine. Yeah.
Before the will come in with a question, or even we talk about the causes, this is an observation, and I want to find out. Mostly in the morning, when you use the washroom, you do whatever you do.
Yeah.
Women, even it happens to men, you urinate. Yeah. There's urine. And then immediately you are going to bath. After you are bathing, you see the urine comes again. It comes again, but in small forms, bit by bit. Is it normal, or there's something causing the bit by bit, or in there's nothing?
No, mostly it's normal.
Okay.
Mostly when you go to the washroom, there is this, it's a psychological thing. Like you're in the washroom and seeing the water and everything around. So it's not really any medical condition. And it's coming in bits because the bladder is not full. But with urine retention, you feel like the bladder is full, but it's not coming. Yes, so that is the difference. Yeah.
So let's talk about the duration. Is there like a specific duration for urination that, maybe every 2 hours, every 1 hour, one has to go to the washroom to urinate? And for the retention, how long, do you define that as urine retention?
Okay, so with the duration of urine, there's no specific duration. It depends solely on your intake of fluids. I'm saying fluids, not water, because drinks and other things too all forms part of fluids. Yeah, so your intake of fluid can increase your frequency of urination. But with the retention, that's the situation. It's not like you don't feel like urinating or there's nothing in the bladder. With the retention, the bladder is full. You feel when you press your lower abdomen, you feel that the urine is there, but it's not flowing. It's like being in a bus to, let's say, Kumasi, and you feel pressed. You've got into a place where the driver has stopped for you to pass urine. You go to the washroom and the urine is not coming. Yes, that is how serious urine retention is. So you feel like you are really pressed.
You really want to piss,
but it's not coming. So it's very painful. It's something that is not very likely. It's very painful. Yeah. So
all right. So as you have established that, if now the person comes in, as you said, people come in with acute urine retention and all of those things. How do you diagnose and how do you go about it?
So with urine retention, mostly it can be diagnosed even by the person. So you are there, you are there, and the urine is not coming. So you know that definitely you have urine retention, and that is the #1 cause of catheterization. So that is what leads to we putting catheter into the penis or into the vagina for females. And some people may think that it's only for the aged, like the catheterization, for instance, but even we have young men having something that we call urethral stricture. that is blockade within the urethra. That one, when they come, a catheter will have to be inserted.
Okay.
And you know, mostly when the catheter is inserted, the reason why the catheter is inserted is to be able to drain the urine from your bladder. And the underlying cause will be dealt with. So we look for the underlying cause. So in men, we may check for the prostate, we may check the urethra for any forms of stricture or all that. In females, we may check the bladder and all that. We may do some vaginal examination and all that to find out if there is cystocell or anything. So when the underlying cause is detected, then the treatment of the underlying cause can be given. Yeah, so most people come and the immediate intervention is for us to put in the catheter so that we can relieve the person of the pain and later do some lab tests to check if there is the prostate enlargement. If there is prostate enlargement, we got you covered. There are medications that can be given to reduce the size. Mostly if the size is very big, mostly the prostate size shouldn't be more than 40. But we have people coming in and it's around 100 plus.
Hey.
Yes, so it
That
means
means it has been there for a long time.
a long time, and sometimes it doesn't really give any symptoms. So if you say you are looking for symptoms before you come in, that may be too late. So when you come in, we do the scan and the prostate enlargement is there. We put in the catheter, give medications, and mostly refer you to come in 2 weeks' time.
Okay.
But most people that comes in 2 weeks' time, you find out that the prostate probably has reduced and we can take off the catheter for them to be able to pass the urine. Yeah, so.
How is the process of the catheter done?
That is
it's just taking.
It's like a straw.
Yes, it's like a straw.
Okay.
So in men, you hold the penis, the hole in there, you push it through. You push the catheter through. You use something that we call KY gel.
Okay.
You put it on it so that it will be smooth for it to go through. So you put it through into the bladder.
That's painful. That's painful.
What do you mean by that's painful?
That's painful.
Yes, how do you know our pain?
But male too, females also have it.
Okay, no, when he's describing us, you can feel the pain, but for now, I am feeling the pain right now.
You know, it's painful, but it's funny enough that when people come in, they even want us to go with that procedure as early as possible because the pain that you feel with the retention is even painful than the process of the catheterization. Yeah, so it's not something that we joke about. You know, when you are a man and you know how sensitive the penis is and you are putting this thing in there. It's not something that is nice at all. Yeah, so that's why we advise that as men and as women, we need to be checking our health. We need to be having this routine checkup because when the prostate is enlarging, you may not notice, depending on the part that is enlarging. We have the central zone, we have the peripheral zone. So if the peripheral zone is what is enlarging, you wouldn't have any symptoms, but then it will be enlarging outwardly, but it will get to a point that it cannot enlarge again and you may have the retention of the urine. So it's important that as men, as we are aging, we need to be checking the prostate. As women, we need to be checking our health, especially after childbirth, because that is when most women that comes in retention of urine come. And apart from even the childbirth, infections too can cause that, because if you have chronic infection, it can cause this stricture that I mentioned. And also people with stroke, if you have stroke, it means that the communication between your brain and your bladder too could be affected. So you feel the sensation, but there's not a communication between the brain and the bladder. The urethral stricture,
the synchronization
the sphincter wouldn't be able to open up for the urine to flow in. So those are some of the things that could cause the retention of the urine.
Doc, if people leave this and they don't treat it, what are some of the complications that they might encounter?
With retention, it will be difficult for people not to treat because because of the pain. Yes, because of the pain that you go to. Even if you don't want to go to the hospital, you have no say.
It'll make you feel uncomfortable.
Yes, you feel very uncomfortable and you need to come. But for some reason, if people decide not to treat, it can lead to something that we call hydronephrosis. The urine will go back to the kidneys, because the kidneys that produces it needs to come out. So if the bladder is full, it goes back. And when it goes back to the kidneys, it means that the kidneys wouldn't be able to sieve the blood well, and it can lead to end-stage renal failure. We all know how difficult it is to treat those kidney conditions and all that. Yeah. So it's one of the major things that could happen. And apart from that too, you know, with the catheterization, if it's inserted, one of the funny things that we mostly say is make sure, for men, make sure you don't get regular erections when the catheter is in there, because because when it's in there and the erection is coming, you know, it will pull through the urethra and it can cause some sores within it.
Please do not allow any woman around anybody to see that.
So it's and Desmond, you agree with me that it's difficult to control that.
You know, sometimes when you have
you see
urine anyway, we'll get to them, but some of the messages are coming in. Let me read this one from George. Says, good morning. I am George, aged 59, and my problem with the urinating is I also have to stay in the washroom always to make sure everything is out after urinating. Sometimes I have to use the tissue to clean some drops. Where can I get the tea to buy? Thanks. So in the first place, let's address that. Is it?
Yeah, it's possible the prostate is enlarging. That's why he's experiencing that. 59. Yeah, so that is one. Even the age alone should even tell you that there could be something wrong with the prostate. And when the prostate is enlarging, you'll be able to pass the urine, but then all wouldn't come. So you have to stay longer in the washroom, straining so that you get everything out. But even with that, all may not come. So after you dress up, you feel like there's this dripping. You have some stains in your trousers and all that. Yeah. So if he's closer to Accra or any of our branches, I will advise you go there, get it checked. Because with his age, he can get the tea all right, but I would rather he check it first. Before he start taking it.
Okay, so some people are calling. Please, you can call this number. Just send us a WhatsApp message. I don't know if producer will permit for us to pick some calls, not on this number though, but I'm sure that will be. But 0553 350000. 0553-000035. It's the WhatsApp number. Send us a WhatsApp message, and Doc is here to help with that. But what about the one that you go to urinate and immediately it doesn't come?
That one too.
That one is normal.
It's not normal. It depends on
the duration before it comes.
Yes. So mostly.
No, the one that you do.
It shouldn't be the case if you are pressed in this age. For children, yes, it's normal.
But I'm just saying, you know, we are guys, and I mean, there's something with guys that you don't know, and we are working together, and one person wants to urinate.
It's sometimes,
right? So sometimes you're just standing there, everybody, and like one starts before the other comes.
So it means the bladder probably wasn't full. But because someone is passing, it's the same as the washroom thing that you talked about. Yeah, it's just the mind playing games with you that you want to urinate, but the bladder isn't full. But when the bladder is full, when you go, it should come. But when you have a problem, a urine retention, the bladder will be full. You feel pressed, but you go, it doesn't come. And mostly. After sex too, sometimes it can delay, especially with the men, because you know the semen also passes through the same place, and the semen is a bit sticky and all that, so it can cause the urethra to collapse, or it can close up, so the urine wouldn't be able to flow, or sometimes too it can split. But that is not a medical condition.
It's like oil and water.
Yeah, you see.
Okay.
Yeah.
Because I was asking that question because sometimes when you're on a bus, the bus gets to a place that everybody has to go to the washroom, blah blah, all of those things. You see, because everybody's going, you also want to go. You get there, and like for 30 seconds, 1 minute, like nothing is coming.
But that's true.
You said it.
I'm just saying, no. I just say so. 0553 000035 is the WhatsApp number. Share with us any concerns you have on WhatsApp. The doc is here, and we'll be helping you with that. And of course, we'll be putting out the numbers. Also, will be on your screen, and we'll talk about the locations where you can find some of the tea to get, so that it can help you with your urine flow.
And for further information, they should contact the Medimosis and hotline numbers on your screen, and you might get to talk to Dr. Prince Osei for more information. Yeah. Doc, finally, before we go, let's talk about the products from Medi.
Yeah, so
how it can help the women and the men. Yeah.
So for urine problems, you know, Prostate Cure has got you covered. We have the tea, we have the capsules. Mostly, I will advise the tea because it's instant. Like you take it when you have the retention and you take it, it is instant. But for prophylaxis sake, when you want to prevent the prostate, the capsules is there for you. You can be taking the capsules morning and evening to prevent you from having any of these conditions that we've talked about. If you're a female and you're having any urine issues, you can go in for Femacare X, because with that, as I said, it's female 360 and it helps with the urine issues, it helps with menstrual issues and all that. Yeah, so those are the medications for the prostate and the urine conditions. But then we have Aphromosis and Medi Plus for the men, exclusively for men. So, Nanaya, you are not part. It's for men, and the name implies Medi Plus. Yeah. So if you know, you know. You go to any pharmacy. Yes, they are Aphromosis. You go to any pharmacy, you can get that. And we have Master T, is an immune booster, so it boosts the immune system. They are all. You can get it from any pharmacy close to you. Yeah. Okay.
Now to some more of the messages here. This one says, "Good morning. Thanks for your presentation on prostatitis." That's it, right?
Yeah, it's a condition. Yeah.
Okay. Can regular exercises reduce the size of the prostate?
Yes, it does. Yeah, it does. So exercise is one of the major things that can help. So if you don't have it, it's a good thing to be exercising so that you don't get it. But mostly when it's enlarged, then there should be some medical intervention. Okay. So when it's enlarged, only the exercise wouldn't help, but you on medication and exercising can help. And it's also strengthening the pelvic floor muscles. You know, with the retention that we talked about, if your pelvic floor muscles are strong enough, you wouldn't be having some of these conditions. There is this exercise called the Kegel exercise. Okay. You know, when you are Kegel exercise.
Kegel.
I don't know if it's Kegel, Kagel. Okay. So, you know, when you are peeing and you are asked to stop the urine, there is a sensation that you do to stop the urine. You squeeze your muscles down there, yeah. So that is that exercise. You can be doing that to strengthen the pelvic floor muscles. For male, for female, it helps a lot. Yeah.
That's interesting.
Yeah.
Okay. This one says, "Good morning. I'm Godwin from Tama. The tip of my penis is changing into reddish."
Hey.
Definitely there is an infection ongoing there. It shouldn't be reddish. If last time when we talked about cystitis, I mentioned that if there is an infection, those are some of the things. Reddish, coloration of the area, hotness, like the place will be hot, and sometimes there could be some rashes in there. So if he's seen that, then probably there's an infection that he has acquired. So he needs to come to Medmosis to get it.
Okay, so there you have it. This one also says, "Good morning, I am 58. When I wake up in the morning, I can hardly wee-wee," and that's what you were wee-wee. But when I sit for like 30 minutes, then it flows from Kwabena.
58, I will advise he come to Medmosis to check the prostate. But mostly, you know, when you wake up in the morning and you have an erection, sometimes it's difficult to pass urine. It's not that you have any medical condition. But when you have an erection, the body is designed such that when there is erection, the bladder closes. So that urine wouldn't pass through the penis. The reason being that when you have an erection, the mind thinks you are about to have sex. So for the urine should to prevent the urine from mixing up with the semen, the bladder closes so that the urine wouldn't mix up with the semen. So when you wake up in the morning and there is erection, there will be some difficulty passing the urine until the penis, like the erection comes down a bit before the urine will be able to flow. So if that is what he's saying, then that could be normal. But with his age, I'll advise that he comes to Medmosis to check.
Okay. All right, Doc, you could take us through the locations and yeah, we'll wrap up.
So our head office is at Adenta Barrier from Medina to Ebri on the Adenta police station. We are on your left. When you're at the police station, look at your left, you see our building there. Ashaman and Tema people can go to Ej Kojo behind the school for the deaf. We have another branch there. Accra Central, we are the ASL Hotel building, close to the Ministry of Road and Highway, Kumasi at Ahinima Kokobin. The products, again, Prostacure T, Prostacure X capsules, Femacure X, Afromosis, Mediplus, Master T. You can get them from any pharmacy out there, and you can pick our numbers to call us in case of anything. And as I said earlier, look out for our screening team close to you from now till September, when we crown the 30th anniversary of Medi Moses Prostate Center. Okay, so those are the numbers on your screen: 024406 8447 and also 0503 494885. Thank you very much, Doc. Someone has been typing for a very long time. The message is never coming. I was waiting for that person so that I could wrap it up. Good morning. I am Ben from Cape Coast. I wee too much in the night. Please, what should I do? It would have been good to get his age, but weeing too much in the night. When you're a man and you're having any urinary issue, there are three things. It could be prostate conditions, it could be diabetes, it could be an infection. Okay. So it could be any of them. So I will advise that he get checked. Sometimes when we are urinating, we always think that it's an infection and we go to the drugstore to get some medications. But you need to check if he has any of he's close to any of our branches. He can go there to get checked, or he can get a Prostacure T to correct that. Yeah. Okay. All right. So I guess that will be all this morning. Thank you very much, Doc, for coming as always. Thank you too. And the cakes and the chocolates and whatever thing you receive, we'll join you at the backstage and we'll come for. As Dr. Prince Osei is the medical PR for Medi Moses. Yes, as always, joining us here.